Hello, good afternoon, and Happy New Year to all my fellow colleagues out there. This is Dr. Velma Scanterbury coming to you live from Dialysis Patient Citizens Educational Center. So I hope you can hear me, and I'm not sure if many of you have gotten the link, but welcome to DPC educational session. This is our first session for 2025, and this is your Ask the Doctor session. Anything you want to know about dialysis or transplantation, and anything else in between, how to get on the list, how to stay healthy, how to do the best that you can to stay upbeat as we enter into what we call a seasonal depression time. You know, we've had this upbeat holidays from Thanksgiving to Christmas to New Year's, and now we're into January. Everything is on a slow, and oftentimes many of us go into this really a depressed state because one, it's cold, the sun is hardly out depending on where you are. If you're in Florida, yes, you're probably good, but if you are in places like Pittsburgh or North, it can get really gloomy. And so sometimes the weather may affect us. We may have arthritis or other things that will cause us to ache more, and we wonder what can we do to get out. So certainly we want to do things that would uplift our spirits. And so for you there, thank you, Nancy, and thank you, Michelle, for logging on. Happy New Year. We're in 2025, and with some changes coming around with Monday being the installation of a new president of the United States. And so we are really need to gear up for whatever may come our way, good or bad. So whether you are on dialysis or transplantation, I want you to try to have a positive outlook. If you think about if you're waiting for a transplant and you're on listed, don't lose hope. Generally, it's January and February, the cold months sometimes can be very slow in terms of organs, but stay positive. We know that there are thousands of people waiting for organ transplantation, and most of them are kidney transplants, over nearly 100,000 people. So we want to also increase your chances of getting transplanted. We want to make sure that you're staying healthy, you're doing the things that would allow you to get on the transplant list. And a lot of that oftentimes is making sure you're cancer free, making sure your heart's good, making sure you're up to date with all your scheduled testing, as well as getting the clearances from all the different subspecialties that they ask for. There's a question in the chat, is what do you think about the process, the transplant that was done with a kidney from a pig? And certainly this has been a desire within the field of transplantation ever since I was a fellow, and that's probably back about 30 years ago, and the hope to be able to genetically engineer and manipulate pig kidneys. When you think about pigs or any other animals, they're different species. So we say the transplant is called a xenotransplantation because you're crossing one species to another. And so we know that there are going to be issues of rejection. So the goal is be able to generate a line of pigs that you manipulate to remove those genes that are more likely to cause recognition by your body as a human being, because as a human you will recognize the pig's genes and therefore reject it. So there's a lot of work goes into making sure that the animals are what have knockout genes, meaning there are genes there that may not get recognized. There are no antibodies on them, in order to promote success from the transplant process by minimizing rejection. We know that for the pig transplant, it will require a lot more immunosuppressive medications and monitoring compared to a human transplant because it is of another species. And right now we hope that with more and more opportunities to do these cases under FDA, under guidance and approval from the government, each one is separate. So this is not something that will go full scale to the public until there's a phase. There are different phases of trials to make sure that the risk of rejection and the risk of tolerance to all the potent medications are worked out. So it is a hopeful start to be able to slowly be able to get the process right. And it will take a long time before insurance will pay for it. So many centers may do it based on a trial basis with the companies putting up the medications and the center having a grant or a funding for these cases, since they're not generally covered by insurance policy. So thank you so much. And with so many natural disasters, what would you recommend to stockpile on medicines or in order to prolong life when scheduling dialysis isn't available? And certainly it's very important when you're trying to figure out what do you do when disaster hits. And so you want to make sure, that you definitely have a supply of medications. I try to tell patients, if you qualify for a 90-day supply of your medication, make sure that you have that 90-day supply and have those medications in a place where if something happens, you can easily get to it. So you want to also have disaster planning for your house or for wherever you live, so that as you have to get out in an emergency, you know where your items are and what's packed and ready to go. Certainly you want to make sure that if you also have family and friends in other locations, that you may want to be able to make arrangements to say, if I have to leave, would it be okay if I come to your location, so that you will know what ahead of time, who you have to reach out to also whether it's dialysis, what areas will accommodate you if you need dialysis. So those are things you can talk about with your family. And it's really we don't think about an exit plan in terms of disaster, but we certainly need to have have a disaster plan in terms of knowing what to do. If you have a CPAP machine, if you want to make sure you have enough distilled water, so that if you're traveling, things like that, you want to make sure you have an emergency kit and various items. So I think those things are important. And then where do you go? So if you have some 10 miles to drive, there are 20 miles to drive, or you have to go 50 miles, you want to make sure that you have items to sustain you, food for an emergency that are non-perishable. And oftentimes I tell folks, often we give things, or we may stockpile cans of items that you could eat in an emergency, but make sure you also have a can opener, because something as simple as that, it can leave us stranded. And we also say oftentimes make sure you have a candle in your car for those times. And if it's possible, to make sure your phones and other items are well charged. Those are also things. So think about what your disaster plan is. They are certainly based on the internet to have a checkoff list. And if dialysis isn't available, then certainly you have to make sure you minimize your fluid intake. If you know that you cannot be dialyzed within a certain number of days, it is important most importantly, to not overload your heart during those times. And diuretics will not work. So your biggest component is not drinking, because you will get fluids from some of the foods you're eating. And it's going to be difficult and you don't want to put your heart in jeopardy. So thank you very much for that question. Can you bring us up to date about the spike in flu and virus infections? Yes, we actually had, we sort of do a monthly update, and for most of the states, they're really not tracking infections. We're looking at hospitalizations, but I can tell you in our office, there certainly is an increase in both the flu and as well as COVID. And also, they're concerned about the avian flu virus currently. So You want to make sure if you're in an area that have concerns for bird flu, that you pay attention to what's going on in your state or your area and look at statistics to make sure you keep yourself safe. Because of the increase in infections, both flu and COVID and RSV, many people are being advised, and it's one of my recommendations, is we go back, you keep yourself safe as far as transplant, as far as being on dialysis. You may want to consider masking. You may want to consider, at least you should also be continuing to use hand sanitizers. Remember, the most frequent thing we don't think about is those doorknobs in the public area. And as you go in and out, you do not know who is infected. So not necessarily have to wear gloves, but make sure you use your hand sanitizers, because we constantly do this. We bring our hands up to our face, we squeeze our nose, and we lick our fingers for one reason or another. And so we transmit those outside infections, whether it's bacteria or viruses, into our own system. So think about keeping yourself safe, because if you should be vaccinated as transplant patients, as dialysis patients. We know that for many patients who are immunosuppressed, they're unable to build as much antibody, as the antibody response is never as great as someone who's not immunosuppressed. So your level may not be as high as someone not a transplant or dialysis patient, but whatever that 20-30% ability to form antibodies is still better than zero. So, and then secondly, you want to be able to make sure that you stay safe and do not contract the virus by not being careful with as you go in and out of stores and we go shopping and into the public. And so certainly stay safe and go back to their hand sanitizers wherever you can as you go in and out of offices or dialysis. Okay, how can sepsis be prevented in dialysis patients? Well, when you think about sepsis, sepsis is an overwhelming infection that occurs when if you think about a small site infection that has now traveled throughout your body system. And sepsis is that once these bacteria spark your body's system to fight off, it can present with not only fevers, your blood pressure can be low. Sepsis means that your whole body is now fighting a very bad infection that is pushing your body to organs to not work well. So you are usually very sick, have to be admitted to a hospital, have to go through IV antibiotics, intravenous antibiotics to get rid of that overwhelming infection. So how did that infection get there in the first place? How did it enter your body? And so if you're on dialysis, it can be through your site of your, if you have a catheter, it's very unlikely because of the precautions that are taken by us having a fistula or a graft in your arm. The nurse is very careful about cleaning those off and keeping them clean. But an indwelling catheter oftentimes can not only through the tract into your blood, allow bacteria to get into your bloodstream, but also through the bacteria tends to stick to things that are foreign. So the plastic itself can cause bacteria to be there. You can also get it through other sites. If you have a wound that becomes infected, that infection can go deep to your system, and those bacteria can then invade into the capillaries and then get into your bloodstream. You may even have a bladder infection that may become a urinary tract infection that can then go on to get an infection in your bloodstream, and something as simple as a tooth infection can also go to your bloodstream. Once it gets into your bloodstream, it can make you very ill, and it requires IV antibiotics to be able to really eliminate all those bugs that are in there. Once we know what the the organism is, we treat it with IV antibiotics. So as a dialysis patient, I know for some patients, they have these catheters in and they want to keep them because it's easier and you're not actually getting stuck in your skin, but you're at risk for overwhelming infection because the longer that stays in, the more of a nidus it becomes for bacteria to grow. And even though you feel that it's a better option for you, it also puts you at risk for life-threatening infection. It isn't meant to be there, and your body sees it as a foreign substance, so gradually it can become a site where the bacteria begin to grow because of its consistency there. So thank you all for joining. Thank you, Yolanda, for telling everyone about dialysis patient citizens. And please, for those of you who are new, please go to the website, DPC Educational Center, Dialysis Patient Citizens, and you will find a wealth of information on that website that will be able to guide you for things from recipes to different groups, how to stay healthy, how to be involved in your state, organizations, advocacy. You can also become a patient advocate in terms of being able to be active in your area, in your state, wherever you are, and also in terms of answering things from anything from, how to keep my phosphorus down to what should I do about too much fluid gain. So yes, there's a wealth of information on this. So thank you all for joining today. I'm excited to see all of you, and be sure to put your questions in the chat. I know that some of you stay on dialysis, and I happened to see a patient probably about 2 weeks ago who has been on dialysis for a few years, and she is not able to get on the transplant list because she feels that dialysis is making her sick, and she feels sick all the time. So unfortunately, she skips dialysis. And that makes it worse because then she skips dialysis. She has more fluid on board. She goes back and she has even more trouble with dialysis, taking off the extra fluid, which then makes her feel even worse because now you're pulling more fluid over 4 hours and you gained it over 5 days because you skipped dialysis, and now you're feeling terrible. As a result of that, you're not seen as a good patient. You're seen as non-compliant. So you want to be able to stay healthy, not miss dialysis. And if you're thinking about transplantation, even if you're not feeling bad, even if you're in dialysis and you're feeling ill, make sure you don't miss your treatments. Stay up to date for all the things you need to do. And, there's no harm, even if you are a little afraid of getting a transplant. If you qualify or your dialysis unit says you can get evaluated, there's nothing that says you cannot change your mind before you get to the final end. At least go and get your initial education about transplant. I always tell people, if you're an educated consumer, then you are better equipped to decide what's best for you and what's not best for you. So go to the transplant center, meet with them, learn all the things. They will give you a very in-depth educational session about all the things you need to do, all the things that are necessary and those which are needed. Remember, going through the process is a wellness check. To get a transplant, you have to make sure you're free of cancer. So you will get all your cancer screens. Is that a good thing or a bad thing? That's a good thing because it puts you on par with everyone else. Then make sure that your heart's up to par, regardless of whatever your cause of end-stage kidney disease. Then see that that's a positive. Now you're getting worked up and getting tests, whether it's a stress test, whether it's an echocardiogram, whether it's a heart cath. Those are all tests that would benefit you by understanding what's going on with your system, even if you change your mind later on. So now you're seeing all the specialists. If you have COPD, you're now seeing a pulmonologist. And so you're seeing many people in order to get you to the best optimal health. See all of those as good things because they may not have happened if you just stayed on dialysis. without the interest in that transplant. So once you are well educated, then you're more equipped to now say, you know what, this is not for me. Now that I've learned everything, perhaps this is not my path. I've been on dialysis so long. Maybe get into transplant, especially for people who have been on PD a lot, learn that your heart is maybe questionable. You learn that your heart's good. So I see this as all good things to give you more information, get you thoroughly checked, and then you make that decision. So don't be afraid of the process. Go through the process and then make your educated decision. Thank you very much for that question. Do anti-rejection medications cause extreme fatigue over time or as a side effect? Generally, for anti-rejection medicine, you're given a load of medication immediately after your transplant. Certainly, your body is going through a change, but fatigue itself may not necessarily be a side effect of the anti-rejection medicine. When you think about fatigue, it's usually what else is going on with you. Certainly, there are patients who may need more steroids because of their underlying disease, and steroids generally make you more revved up than it would give you fatigue. Sometimes some of the medicines may cause insomnia or trouble sleeping, or may give you nightmares, but once the dose is adjusted, that should go away. So if you're fatigued over a long time, then you want to really talk to your doctor about underlying causes. It may not be the medications itself. You want to make sure that you're sleeping well, that you don't have sleep apnea, which is keeping you up at night, which then makes you tired during the day. So you want to make sure that you check your other medications and make sure that some of your other antihypertensive medicines or other issues that you may have may be also side effect. And so when you think of fatigue itself, it can be due to many other things other than just the anti-rejection medicine, because they themselves may not necessarily be the cause of your fatigue. Because as a transplant patient, you are on so many other medications for other things that you have to take them all into consideration. So if that's an issue that you're facing, please discuss that with your doctor. So another question is, what's the best way to control your phosphorus? Unfortunately, dialysis doesn't take out phosphorus, so your phosphorus that you have, whether it's high or low, is an issue with the phosphorus that you take in. So most of all, you have to limit those foods that are high in phosphorus, so you're not then having to struggle with getting the phosphorus out of your body. And so the phosphorus is then tried to be eliminated in your system, either by binding or by excretion. So oftentimes, knowing what foods you're eating, if you're off your limited diet, if you're still drinking colas, if you're still eating a lot of cheese, if you're doing a lot of dairy products, those things will add to your high phosphorus level. So you have to start with the beginning part. Minimize what's entering into your body is the best way to control your phosphorus. Working to eliminate it after it's there can be most difficult. And secondly, as your phosphorus level gets higher than what it should be, that begins to deposit all over your body. So your high phosphorus levels can make your skin change color. Most of all, it gets into your blood vessels and add to what we call arteriosclerosis or plaque disease, which then makes your vessels very hard and can cause you not to be a suitable candidate for transplantation because of calcium phosphorus deposition within your blood vessels. So I know most people are switched from their many different new medications on board for high phosphorus levels. So talk to your healthcare provider. Make sure if your phosphorus is still high that you're doing all you can with your diet and you're taking your medications and it's still not working, then have a discussion about what else you can take to bring that phosphorus down to normal. It's very important. The longer you're on dialysis, the more damage you do to your blood vessels. So thank you very much for that question. And it becomes a factor where everything else, oftentimes with patients, in your CT scan from year to year, you see more and more deposition of calcium, of phosphorus in your blood vessels, and that can be a very determining factor of whether you're a good or bad transplant candidate. Thank you so much. Another question: dialysis patients, like others, are often depreciated. What do you recommend to help these patients in their journey? And I think, yeah, that's a great question, because one of the things that often concerns me is oftentimes people, community or healthcare community, look at dialysis patients as not long-term patients. And so they minimize healthcare surveillances because of the possibility that they may have a short lifespan. And this is where you, as a dialysis patient, needs to advocate for yourself in terms of being able to say, okay, I'm your family. We all tend to get depressed and feel, okay, now there's no hope for me. But you have to see yourself, and oftentimes it may require a therapist to help you get there. You have to see yourself as a viable candidate. You have to see yourself as being as worthy of the same care as anyone else, and demand that care, because your insurance is paying your doctors for taking care of you. So I urge you to find someone who will advocate for you if you're not able to do it for yourself. And this is why it's so important for those who, when you go to your physician's office or they see you, you involve someone else other than you within your care, so that you may not be able to advocate for yourself, but they can advocate for you. Make sure that all the right things are being done for you. And oftentimes with renal failure, you may not be able, your thinking process may be off because of the high urea, and you may not be thinking of all the questions you may ask. So oftentimes it's nice to write these things down before you see your doctor, so you can ask all the important questions. How am I doing? How can I improve? Are there any other healthy things? Are there other tests that I can do to improve my status? Why am I not on the list? What needs to be done? So I encourage you to talk to other dialysis patients, talk to your family. I'll find an advocate, someone who can really advocate for you on your life's journey, and as well as your health journey, so that you are optimizing your health and you're seeing yourself do whatever it takes so that you can have that positive outlook, and you can have that hope for the future, in knowing that there's something better for you out there, and that there's some better outcomes, and whether it's improving your dialysis, whether it's optimizing your health so that you can be a better transplant candidate, or whether it's getting on the transplant list so that you can lead a healthier life. So I appreciate all those questions. And if you are not a member of DPC, I encourage you to go ahead and join. Thea says, I'm 43 and been battling kidney disease for 31 years. Dialysis is not a death sentence. We can live long with proper care. And so I think that's definitely a positive. It's not a life sentence. Dialysis doesn't mean die. And so you have to, if others are minimizing your health or not appreciating you as a patient, if that's a healthcare provider who you feel they're not looking out for your best interest, perhaps you need another healthcare provider, because they have to have your best interests at heart. And I say that as a healthcare provider because oftentimes I see doctors talking down to patients, not telling them, not speaking to them in terms of those things that they can understand. So advocate for yourself, advocate for others, and find someone, if you cannot speak up, to do that for you. Thank you so much. We had a great session. Thank you for all your questions. Have a blessed day. This is 2025. Enjoy the rest of your day, your week, and we'll see you next month. Take care.